25 years ago, I lost my son to SIDS. I was a young mother. I encountered a very poor experience. My son was brought into the hospital and we were treated very differently. I was denied the right to hold my son and the nurses turned their backs on me. Initially, I was angry, but I always remember what my grandpa said, and I didn't want my son's memory to be in vain. So I said I was going to be one of those nurses and I was going to help our Indigenous people, and so that they never had to experience this. And if they happen to go through that tragedy, that they would be supported at least. That's what drew me here. I truly believe it was that calling for me, and it was 25 years ago. With the Indigenous Support Line, we are a part of Alberta Health Services, but we are Indigenous, and so when callers call in, that trust is there. We have that shared experience, and it truly is a safe place for Indigenous callers.
It actually started from a discussion I remember very clearly. We were in the Wisdom Council meeting, and one of the members from the North had an incident in the hospital, and they wanted to put forth a concern, and they just didn't feel heard. This really resonated with a lot of the members of the Wisdom Council, and they said, this is happening too much for our Indigenous people. They don't have a safe place to go, they don't have a safe place to call, and that we really need something specific for our Indigenous peoples. And so they put forth the idea for an Indigenous 1-800 toll-free line where Indigenous peoples could put forth a patient concern. And so the Wisdom Council overwhelmingly supported to say, let's test this in the North, and then hopefully spread that across the province.
So what kind of resources are you guys looking for?
I want it to be like you're talking to your sibling or talking to your cousin or someone who truly cares about you, someone who you will be a part of and feel welcome with.
Our workers are actually called listeners for that very reason, and so it is really just to be there to listen to the diversity of our Indigenous peoples so that we can try to do a better job of supporting where they're at and the needs that they have.
You look at anyone that was raised by their grandparents or in our traditional ways, that's what we're taught. We're taught to listen, and then you're able to find that understanding of where a person's at, and then you can help them in a better way.
I'm actually really excited about my team. Everybody comes from a different background, whether they grew up in the city or on reserve, whether they're connected to the tradition or they're getting connected. Just being able to have all of us together and being able to support each other. And I think that's the most important part about this team, is being able to support each other.
I know it's a number that you call, but it feels like they're holding your hand along the way, walking with you.
I think it just kind of demonstrates the power of community and how, when a community comes together, incredible things come out of that.
The more we're doing this work, the more we realize how needed it is, especially with the diversity of our people, and being able to address those concerns that might be too complex for general care.
Our Indigenous peoples often have what I call really heavy backpacks that are below the surface that you don't often see. And so, being able to have someone there to call to kind of help you unpack that backpack, I think is a really, really important component of the line that I'm really proud and honored that we also are able to provide that type of support.
Every time I talk about the support line, it always comes to my heart and feel like, oh, that's my baby. That's something to be proud of.
For me, the most rewarding thing is be able to talk with my community in our own way. We don't have to present in a way that's intimidating, professional, whatever. We are able to communicate from person to person. And I think that's the biggest thing, is being able to support them and let them know that we're there to help them.
I think about how many times they've fallen through the cracks, and now there's a place where they can go, a place where they can call and get that support that, every other time maybe they've tried, they've either hit a roadblock or, given up, and we don't want that. Our people are so incredible. They might just need a little bit of extra help here and there. And so I know that this line can offer that.
There's no other line like the Indigenous Support Line, and I believe it's improving access to care. It's rebuilding that trust in the system as well. I get to see the changes that it's making in the healthcare system that other people don't see. and they may be small, but eventually people will see the change.
I think about our people and that I was, gifted this honor to be able to provide, some leaderships and guidance to the development of the line. Everyone says it's my baby, but it's so much more than just a project. I think about how it's helping our people. That's what I want in life. I've always wanted in life. So it's really special to me.